Hey guys, sorry about that. Just had a little screen error on the TV here. We only have a couple slides left to go over. We talked about the income statement, the cash flow, our services. What I wanted to look at was our financial condition for 2019. What this shows, we have broken down the numbers here, talking about current ratio, total margins, operating costs. What I want to show you is this is Kansas. Here on the right, the benchmark for Kansas. Their margins, negative, 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 negative. All of ours, positive. So when you look at the benchmark data, the current ratio is about the same. Our total margin is 2 levels higher than Kansas. Our cash flow margin is significantly higher than Kansas. Normally Kansas hospitals are losing money is what that's showing. We are gaining money. Return on equity, 18% return on equity. Profitable businesses outside of healthcare industries usually are about 20 to 30% return on their equity. That is outstanding. So for us to be at 18% and Kansas to be -3 for the benchmark, we are really, really doing a good job with our financial condition. Days cash on hand, we have 51 days cash on hand. That means if we made no money for 51 days, we could still operate. Days in accounts receivable, a lot better than Kansas. Days in accounts payable, our patient deduction rate, our salaries to net ratio is all better. So what that means is just what we've instilled in the last 2 years is really, really working, and we want to continue with that progress. So finally, to end what we talked about, our strategic plan for the next couple years here, we want to improve on our quality, so we want to improve on our risk management. These are the percentages we got taking surveys throughout the hospital. We want this to be at 100%. We want our risk management to be 24 hours, 100% all the time. We need to get better at recognizing and appreciating our employees for their hard work. The hospital is not going to be what they are without the employees that work in it. So with a satisfaction of a 2.2 out of 5, we really need to implement some things that show employee appreciation, like having a wellness program with reimbursement, sponsoring things in the hospital, doing more activities, improving the satisfaction of people going to work and feeling happy about what they're doing, because they are really doing a great job here. And lastly, improve our discharge process. That is very tough. What we can do is try to make things smoother with social work, doctors, care providers, having a collaborative team to really help with those difficult discharges. Patient satisfaction, we want to improve on our meal quality. I mean, hospital food, we all know, isn't the best, but if we can improve a little bit on the meals, take some patient surveys, kind of see what people would like. We want to continue that with dietary, so we're going to start a program to improve that. Physician courtesy, skill and courtesy. We'll talk to our physicians, try to be a little bit more humble with the whole person care. We want to make sure that people are understanding what they're being told. Medical jargon is very difficult to understand, especially if you've never been in the medical field. And then again, I put discharge process twice because I think it's very important to make the discharge process smooth. It's hard because when you think of a family member that goes to the hospital, what's the next step? Are they safe to go home? Do they need a nursing home? Why is this process so difficult? Why is this hard with insurance? I think if we could solve some of those problems, the community would be really appreciative of how well we handle their loved ones. So this is just another way to help our community too, by having safe discharge process, improving that kind of that flow, that sequence. Financial performance, like I said, we're hitting it out of the park with finances, really improving on everything. A lot of green compared to the Kansas benchmarks, so we'll continue with that. What we want to do for growth, we want to implement home services. So home health, come to the home, work with you in your home where you don't have to come to the hospital or to an outpatient. It's just a lot better feeling when you can do your stuff at home and you don't have to leave, especially for those people that have difficulty leaving and can't drive. We're going to start up a cardiac rehab program. So we're going to start implementing with the total procedures. We want to start doing like coronary bypass grafts. We want to start doing TAVRs. So we're going to start doing that. Building our ICU, including a couple ICU beds, especially with the COVID scenario coming on. And then we're going to have a joint replacement program. We're going to talk with our surgeons and start doing that instead of people driving 4 to 5 hours to get to Kansas City or Wichita to get a joint replacement. We're going to start doing them here. And lastly, our employee and community relations. We're going to improve on our recognition for our employees, start an incentive program for wellness for our employees, meal planning for night staff. We're going to advertise to local regional areas, schools, and nursing homes, increase sponsorship for local activities, and begin hosting local events, 5Ks, cancer walks, mental health awareness days, just stuff to get out in the community and show that River Community Hospital is really looking forward to working with you folks, working for our county, for our region, and just wanting to prove that we're one of the better hospitals in Kansas, if not the country. So if you guys have any questions, feel free to ask, but hopefully that was a good presentation on how we've been doing the last couple of years.
Does River Community Hospital have a kind of like social or morale committee that could help start organizing some of those employee events?
So what we're going to do, yes, we're going to start a social committee group. So we're going to have a wellness program coordinator. We're going to open that new job. So the head of that director's position, that coordinator, she's going to establish a network between the departments of implementing ways like, what are some fun ways we can get staff engaged? What are some ways to show employee appreciation? We actually, when I was working at another hospital, we had a wellness program where you get paid at the end of the year for doing challenges throughout the year based on if you're staying active, if you're getting enough sleep at night, if you're hydrating enough during the day. So we're starting that, and that's kind of in the works here for the next year. That is something we really want to work on though, because staff engagement is super important and retention is super important, especially for nurses. If we didn't have nurses, we wouldn't have a hospital. So we want to do our best to really make people feel whole and wanted when they come to work, and we're going to be working on that here pretty good. So
okay, thank you.
Yeah, thank you.